Hello, I am Dr. Shekhar Srivastav. I am head of the department Orthopedics at St. Parmanand Hospital, and I specialize in robotic knee replacement. Knee osteoarthritis is one of the commonest problems, and knee replacement is one of the commonest surgery done across the world. It is a very precise surgery, and the challenge here is that the implant should last the patient's lifetime. The patients are getting younger, the patient's demands are getting more and more, so the techniques have also improved. Robotic knee surgery has brought a greater degree of precision and accuracy in this surgery. Normally in conventional methods, the implants are placed by making the ends of the bone ready with some manual jigs. When we are using these manual jigs, then there is a chance of error. There are some chance of human error in judgment as well as in execution of the plan. Now, if the implants are not placed in perfect alignment, then the function is not optimum, and as well as the longevity of the implant decreases. Now, in robotic knee replacement, what we do, we first take the CT scan of the whole limb of the patient, and then we make a virtual 3D model of the patient's knee, over which we apply the implant in different degree of combination and permutation, and there we decide which will be the optimum position of the implant. Then that information is fed into the robotic arm, which takes the cut with sub-millimeter accuracy so that a perfect alignment of the implant can be attained. This Cubis robotic system is the world's first and Delhi's first fully autonomous robotic system, and it helps in personalized planning for each knee of the patient, and accordingly the implants can be placed in perfect position. Now, this helps in good functional outcome. The planning is done beforehand, so there is a lesser degree of bone loss as well as there is no invasion of the soft tissue. So the recovery is much faster, the pain is less, and the patient's function is attained very early. As the implant alignment is also perfect, so the longevity of the implant also increases. So robotic knee replacement surgery combines the experience, the knowledge of the surgeon with the accuracy of the robot, and it gives a very good functional result. Thank you.